Hello and welcome to Sugar Loop, your go-to source for all things related to diabetes management and overall health and wellness. In today's video, we're going to be discussing the link between diabetes and heart disease. What is diabetes? Before we dive into the connection between these two conditions, let's first define what diabetes is. Diabetes is a chronic condition that affects the way the body processes blood sugar or glucose. Glucose is an important source of energy for the body's cells and is derived from the foods we eat. In people with diabetes, the body either doesn't produce enough insulin, a hormone that regulates blood sugar, or doesn't properly use the insulin it does produce. This leads to an excess of glucose in the blood, which can cause a variety of health problems if left unchecked. Types of diabetes. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes is an autoimmune disorder in which the body's immune system attacks and destroys the cells in the pancreas that produce insulin. This type of diabetes is typically diagnosed in children and young adults, and it requires lifelong treatment with insulin injections or an insulin pump. Type 2 diabetes is the most common form of diabetes, and it occurs when the body becomes resistant to the effects of insulin or doesn't produce enough insulin to maintain normal blood sugar levels. Type 2 diabetes is often associated with being overweight or obese, and it is typically diagnosed in adults. However, the increasing prevalence of obesity in children has led to an increase in the number of children being diagnosed with type 2 diabetes. What is heart disease? Now that we've reviewed what diabetes is, let's define heart disease. Heart disease is a term used to describe a range of conditions that affect the heart. These conditions can include coronary artery disease, heart attacks, heart failure, and arrhythmias. Heart disease is the leading cause of death globally, and it occurs when the blood vessels that supply oxygen and nutrients to the heart become damaged or diseased. The link between diabetes and heart disease. So, what is the link between diabetes and heart disease? People with diabetes are at an increased risk for developing heart disease. In fact, according to the Centers for Disease Control and Prevention, CDC, people with diabetes are 2 to 4 times more likely to develop heart disease than those without diabetes. There are several reasons why people with diabetes are at an increased risk for heart disease. First, high blood sugar levels can damage the blood vessels and nerves that supply the heart, leading to an increased risk for heart attack and stroke. Second, people with diabetes are more likely to have other risk factors for heart disease, such as high blood pressure, high cholesterol, and obesity. Managing diabetes to reduce the risk of heart disease. So what can be done to reduce the risk of heart disease in people with diabetes? The good news is that there are several things you can do to manage your diabetes and lower your risk of heart disease. These include maintaining good blood sugar control through a combination of medication, diet, and exercise. Taking medications as prescribed to manage blood pressure and cholesterol levels. Quitting smoking, if you smoke. Getting regular physical activity. Eating a healthy diet that is low in saturated and trans fats and high in fruits, vegetables, and whole grains. Conclusion. In conclusion, there is a strong link between diabetes and heart disease. People with diabetes are at an increased risk for developing heart disease, but by managing their diabetes and adopting healthy lifestyle habits, they can greatly reduce this risk. If you have diabetes, it is important to work closely with your healthcare team.